So we're reaching close to 30 million people in the United States now with diabetes. We care about it even more as a healthcare community and at UCF College of Medicine because of the burden it's placing on our healthcare system and on patients' quality of life. So one of the main defects or one of the main problems in type 2 diabetes, one of the things that happens is our liver makes more glucose or sugar. So Metformin targets that area directly. So it's actually very good at lowering blood sugars. With all the updated guidelines and changing guidelines that the American Diabetes Association publishes every year, this medication has still remained first line. So insulin therapy is required by many patients to obtain blood glucose control because it is the most effective. So it essentially works to take the glucose that's sitting in your bloodstream and it makes it be taken up into your kidneys, into your liver, and go out of the bloodstream. And when it sits in the bloodstream, that's when the damage is done. We kind of use a three-prong approach, like I mentioned. We said medications, and then the next one would be physical activity. Strive for 30 minutes, 5 days a week. We like to kind of give patients tools to remember because you go see a healthcare provider and you need to know what to ask. So think about it as A, B, C's. A is your A1C. That's a percentage value. That's an estimate of your blood sugars over the last 3 months. B is blood pressure. C is cholesterol. So you need medicine, you need physical activity, and then of course, eating. The two meal planning approaches that I want to talk about are the plate method and carb counting. The whole focus on carb counting is on the carb choice, but a carb choice just means 15 grams of carbs. If you can figure out what's 15 grams of carbs, then you can slowly work to get meals prepared that are around 60 grams of carbs. I would say for carb counting, a reasonable place to start is 60 grams per meal, 15 grams per snack. So the plate method is you're taking a 9-inch plate and you're dividing it. Basically, a quarter of your plate is your breads, your grains, your starchy veggies. And then here, this is your next 15 grams and this is your next 15 grams, right? So essentially you're still at 60 grams of carbs. So my point to you is you can do this, you can pick this method, but you're essentially doing the same thing. You just have to pick the one that works for you, that you like. And I'd like to end with this. If we could give every person the right amount of nourishment and exercise, not too much, not too little, we will have found the safest way to health. And it goes back to everything in moderation. So thank you.